Tonight, stealing from Medicare.
If you are serious about health care in America, you cannot continue to wink at Medicare and Medicaid fraud. I don't want to hear rhetoric from politicians. I want to see more people on the front line bringing the liars, cheats, and thieves to justice.
Patrick Burns has been looking into the dark underbelly of the medical industry for years. He works at Taxpayers Against Fraud. That's a nonprofit that consults with a special class of whistleblowers who expose public and private institutions that are defrauding the American taxpayer. Big Medicare fraud cases come into the group's offices, and they're often sent on to OIG for further investigation.
Our health care system, Medicare, Medicaid, private insurance, is complicated by design. The people up on Capitol Hill aren't stupid. The people in the healthcare industry aren't stupid. But the people on Capitol Hill are paid by the healthcare industry to create a very, very complicated, tortured mess of a healthcare system. And the reason for that is in the complexity is the fraud. By creating a complicated system, you can figure a way to manipulate the system and to rig the game for your benefit.
Burns says he has nothing but respect for OIG, and operations like the ones in Detroit are important. But he says the biggest whistleblowing cases that are crossing his desk involve blue-chip pharmaceutical companies and their top management. Frauds that can be measured in the billions of dollars. With the competition for drug profits fierce, Burns says whistleblowers have revealed illegal practices meant to gain a highly profitable edge in the market.
Drug companies have large staffs who go out and market the drugs, and to be blunt, they pay the doctors. These are just straight up kickbacks. One of the things they can do is they can go to a doctor and say, gee, Dr. Jones, I see that you write 20 prescriptions a month for this drug, which is our competitor's drug. If you wrote 35 prescriptions a month for our drug, then you would be a key opinion leader. And that's what they call them, key opinion leader. And we'd pay you $4,000 a month. And if you wrote 40 prescriptions a month, then you might be able to go to Honolulu for our annual conference of key opinion leaders. So it's straight up bribery.
The bribes to doctors, Burns says, can distort their judgment, causing the doctors to write prescriptions for expensive medicines that may be medically unnecessary.
And they can rationalize it a lot of different ways. The simple way is to say it, hey, I could give him aspirin, or I could give him Bextra. Aspirin will work, but Bextra will pay me more. And what do I care? It's really not harming anybody. Besides, it's not the patient paying the drug for this drug. And I'm benefiting. And so the cost of it is fobbed off to nameless, faceless people, which is, of course, the American taxpayer.
This isn't just some random example. Bextra, a painkiller made by Pfizer and approved for arthritis and menstrual cramps, was at the heart of a fraud investigation launched by a whistleblower who worked with Taxpayers Against Fraud. In September 2009, Pfizer paid the U.S. government $2.3 billion to settle civil and criminal allegations that it had illegally marketed Bextra, along with a number of its other drugs, for uses that were not approved by the FDA. The government alleged that Pfizer caused fraudulent claims to be submitted to Medicare to the tune of hundreds of millions of dollars. It was the largest healthcare fraud settlement and largest criminal fine of any kind ever. Burns says Pfizer just looks at it as the price of doing business.
The point here, this wasn't an accident. This was the marketing plan of Pfizer. This was how they made their profit. Pfizer banked about $175 billion in sales on these drugs over the span that this lawsuit encompassed. They paid $2.4 billion in fines. $2.3 billion, it sounds like a jaw-dropping amount of money, and it is, until you look at the volume of sales that the company made and figure out what kind of profit they made. Pfizer did quite well. I'll be honest with you. If I had designed these frauds for Pfizer, after this settlement, I would have walked in and demanded a raise. This was a money-making deal. Let's do it again.
And Pfizer did. The latest settlement was the company's third with the government over illegal marketing activities since 2002. And Pfizer is not alone. Eli Lilly recently pled guilty and paid $1.4 billion for illegally marketing an antipsychotic drug to treat dementia in elderly patients, knowing there was no clinical evidence the drug worked for this purpose.
Here's the irony. Only person who lost their job in this were the whistleblowers. Nobody at Pfizer lost their job. Nobody at Lilly lost their job. Nobody at Pfizer or Lilly went to jail after stealing billions of dollars from U.S. taxpayers. It's absolutely outrageous that if you push a little old lady down in the street and snatch her purse with $50 in it, you're going to go to jail for 5 years. But if you drug that lady within an inch of consciousness for years at a time in a nursing home and bill Uncle Sam and steal billions of dollars, nobody goes to jail.